Hello, every day we gain a little more understanding, and in this video, we will explore the dangers of X-ray imaging. Let's get started. As you can see, when doctors want to observe the internal parts of your body, especially when checking for broken bones, they often use X-rays. An X-ray machine is like a camera that can see through your body. However, some people believe that X-rays can be harmful to your health, even potentially causing cancer. Is that true or not? Let's find out. First, let's understand how X-ray machines work. I'll explain it in the simplest way. Basically, X-ray imaging is fundamentally exploiting the penetrating property of X-rays. X-rays are a type of strong electromagnetic radiation at short wavelengths, making them highly penetrative. When a beam of X-rays passes through the body, thin and soft structures allow the X-rays to pass through easily. Harder structures like bones absorb the X-rays, preventing them from passing through. By controlling how many X-rays penetrate through the body, we can create images of the internal organs. You can clearly see on the images that areas where X-rays can't pass through appear white, where they pass through less appear gray, and where they pass through more appear black. To generate X-rays, a large electric current is passed through the two electrodes of an X-ray tube. This generates a strong magnetic field, causing electrons to move at high speeds and collide with atoms at the other electrode. Due to the high velocity, these electrons alter the atomic structure, emitting X-rays in the process. Now all that's needed is to pass X-rays through the person, placing a film or an electronic screen on the other side to capture the results. Back to the main question of the video, are X-rays dangerous? Or more precisely, do X-rays have harmful effects when they penetrate the body? The answer is yes. X-rays are similar to gamma rays, a type of ionizing radiation. Scientists are still debating the differences between X-rays and gamma rays because they share similar characteristics. You already know how dangerous ionizing radiation can be. Specifically, when X-rays were discovered in 1895, scientists, doctors, and inventors conducted numerous studies and experiments. Many people experienced burns, hair loss, and more severe problems. These issues were reported in technical journals as early as 1896. In that same year, in February 1986, Professor Daniel and Dr. Dudley conducted an experiment involving X-raying Dr. Dudley's head, which resulted in hair loss. Another report published in Dr. Hawk's Electrical Review showed severe burns on his hands and chest during the demonstration with X-rays. Other experimenters, including Elihu Thomson and Nikola Tesla, also suffered burns. However, those were the early days of X-ray discovery, when safety measures were not well understood. Today, when taking X-rays, precautions are taken to use just enough radiation to produce a clear image while minimizing exposure. However, X-ray imaging still poses potential risks, primarily the risk of cancer. Let's delve deeper into why X-rays can cause cancer. The principle is as follows. When X-rays pass through the body, they interact with the molecules and atoms within us. Since our bodies are composed of countless atoms and molecules, X-rays can affect them. If you've watched videos on cancer, you may already know that when molecules in cells become ionized and the DNA molecules are altered, normal DNA function is disrupted, leading to the development of cancerous cells. So it's clear that X-rays can potentially cause cancer. The question then is, how high or low is the risk of getting cancer when undergoing X-ray imaging? Each part of our body requires a different amount of X-rays for imaging. As mentioned earlier, the less radiation, the better. For instance, when X-raying the hand, the radiation dose is less than 0.01 MSV, and the likelihood of cancer is minimal, with millions of people needed to find one case. For a cervical spine X-ray which requires 0.08 MSV, about 200,000 people would need to be X-rayed to potentially find one cancer case. If undergoing a CT scan, the situation is more serious, as CT scans provide 3D images for more accurate diagnosis, but expose the patient to higher radiation doses, up to 8 MSV. Consequently, about 2,500 people would need CT scans for one cancer case to potentially occur. Another important consideration is the limitation of X-ray imaging for children and pregnant women. Children are more sensitive to radiation and they have more time for potential cancer development and other issues. Therefore, through this video, you've seen the X-rays, like other forms of ionizing radiation, can indeed pose cancer risks by affecting the molecules and atoms in our bodies, leading to DNA alterations. We should only undergo X-ray imaging when necessary and limit X-ray exposure for children. Thank you for watching the video, goodbye, and see you again.